So should I be looking at you or should I be looking at the camp? You.
Yeah,
You.
fine.
Let's see what you're about to get. It's like a test, you know? Same thing as what you just watched this year. I'm just going to ask you a few questions about your experience in Co-op. What was your experience in Co-op?
I loved Co-op. I think it was a great experience to see what and how pharmacy works in a hospital setting.
Co-op is a one-of-a-kind experience that you're not really going to find anywhere else, I don't think. It's really just a great way to learn about the medical field as you're going through school.
I didn't really know what co-op meant, so I kind of had to do a little digging, look at YouTube vlogs of people, like day in my life at Northeastern.
Co-op allows you to get hands-on experience from what you learned in a classroom. So it's very easy to read a book and be tested on it and also just keep moving through it. But applying these things that you learned in class is a very valuable insight as well.
You get to experience what it's like to work right next to pharmacists and really just get to apply your knowledge.
I think co-op is really what you make of it. For me personally, I was able to reach out to the different individuals that I was interested in working with, and just hearing their expertise and the whole breadth of knowledge that they had was very positive.
They all understand you're a student. They understand there's a learning curve. They really understand you as a whole. And a lot of these healthcare providers that you're working with are Northeastern graduates, so they truly understand the position you're in. So there's really a lot of pressure that's taken off of you knowing that everyone was in your shoes at one point.
Even though 6 months kind of sounds like a long time, it's really not while you're experiencing it.
When you were out on 4 months, right when you were trying to get your groove and understanding your job, you were leaving. So I think 6 months was great. You had your learning curve for the first few months, and then after that you knew what you were doing. You were an integral part of the team. It was really, really great, especially having 6 months.
Do you feel Northeastern prepared you for your Co-op?
Absolutely. I think that we had a lot of opportunities to get certificate training. We had case studies. We also learned a lot of things in lab that helped us facilitate our conversations with patients, how to apply our skills, and also have some knowledge to draw back from.
We truly do have a family here at Northeastern. There was so many people that I could turn to, whether that was even my co-op advisor. Literally every single person I know, if I reached out to them and I said to them, I'm struggling, I need help, everyone would have your back. So I think that is one amazing thing about Northeastern, is we do truly have a family.
And what Northeastern does in co-op, it just allows us to have our experiences early on. So by the time we graduate and go out into the field, we have something to pull from in our knowledge. So
getting your foot in the door very early and very often at these big name hospitals is something that you don't get anywhere else.
Or a positive experience that they don't really talk too much about co-op is you get to meet the best people ever.
I would definitely say to seize any opportunity that comes your way or make your own opportunities.
You have to experience it for yourself.